So my article is about the management of peripheral artery disease, also known as PAD. So as we just learned, this disease is when our arteries that carry blood become narrowed or blocked. So this is usually a result of plaque or fatty deposits that become stored on the artery walls. So essentially, it reduces the space where blood can travel. So the symptoms occur in the lower extremity and can lead to a lot of complications like pain, cramps, wounds on the bottom of your feet, and loss of hair on your feet or toes. There's also a lot of cardio complications like a heart attack, stroke, and sometimes even death when it's not treated or managed. So when people are diagnosed with PAD, the initial recommendations are to modify their diet, introduce exercise in their daily life, and also to quit any sort of smoking, especially cigarette smoking. So the article mentions a diet that's usually recommended, which is the Mediterranean diet, simply because it has foods with anti-inflammatory properties that may help improve outcomes. This diet focuses a lot on like fruits, vegetables, leaner proteins, and these all have like healthier fats instead of like saturated fats. So the article also states how important it is to quit smoking, just because it's associated with the decreased risk and like the progression of the disease, which can like lead to like critical limb ischemia, which leads to amputation. So the reason smoking can be very detrimental is because it causes arterial damage, and the nicotine that's in cigarettes and stuff can also like, accelerate your plaque production, which again would narrow the arteries. And then the last thing that the article mentioned about like lifestyle modification is obviously exercise. So patients with PAD typically like when they exercise, it causes a lot of pain. And that's because when we exercise, we need more oxygen, more blood flow. So if they already have little space and we're requiring more, it's going to cause pain. So typically they recommend supervised exercise therapy or SET. And then with this program, they are being monitored by a physician. So when they do reach that pain, they know to stop and they're given a lot of breaks. And this is a more controlled way of improving their lifestyle.